about chronic injuries and chronic pain. I think those of us who are in my age bracket are very familiar with things becoming more chronic than they used to. And I think some of the main points I want to make is kind of why that happens. I think that's the first question. Why do I have tennis elbow, and why won't it heal? If if I was 18 or 20 and I was playing some tennis or playing golf or doing whatever sport that required a lot of repetitive activities, I could get a strain or a sprain, and it most likely would clear up without too much intervention. Those of us who are beyond that 40-year mark, and in my case beyond the 50-year mark now, that's kind of a reality of recreational sports and activities. One of the things that creates chronicity is a lack of growth hormone. As we age, especially as we get beyond 40, 45, the pituitary begins to slow down growth hormone production. And then the cells that are responsible for healing, the fibroblasts and cytokines and stem cells and all of the construction workers that put the hard hats on and go to the job site are no longer showing up like they did before. So our job in the rehab world is try and figure out ways to stimulate that growth and repair effect. So if I have, let's say I have a tennis elbow or a golfer's elbow on this medial side, basically we have a tendon that's gone into a phase 2 or degenerative state instead of the good stuff, the phase 1 healing. And one of the things that we've noticed, and I in particular noticed during the observation of a surgery of just such a problem, it was in that case it was a lateral epicondylitis. The tendon was gray instead of that pearly white like most tendons are. When you shine a surgical light on them, you expect them to refract that light and look good. And the grayness, the surgeon pointed out to me, was almost like a degenerative state, and I'm not sure that necrosis is the right word, but certainly dead cells. So basically, he just took a surgical glove and sloughed the cells off, and then scraped it with a scalpel, which seemed fairly simplistic to me. The incision was closed, and the patient, one of my patients that I had referred to him for that procedure, was good to go after a couple of weeks. So it was a pretty simple surgery. However, surgeries are surgeries, and they certainly are invasive. So back to the conservative, rehabilitative side of things, we have some new tools. One of them is the Class 4 laser. Some of the NFL teams and NBA teams have latched onto the use of the Class 4 laser as a stimulator of phase 1 healing. So the Class 4 laser that we have is made by LightCure, and LightCure has done extensive research into how to stimulate that phase 1 healing. And so when we use it on a chronic tendon problem, and usually when you're beyond 45 years old and you're told you have tendonitis, it's not really tendonitis, it's tendinosis or tendinopathy, which means you're in that degenerative phase 2 state, and that's why it's not healing. So when we use the laser, that's basically what we're doing. And it's not a laser that does any cutting or opening of the lesion. It basically feels warm, feels kind of like shining a super warm, maybe like a microwave oven going off on the inside of the tendon. So it's pleasant, and many of our patients do really well with the Class 4 laser. As another treatment tool, another option for stimulating the phase 1 healing, we also have an acupuncture therapist in this office. Our acupuncturist is Jim Polciani, and I'll introduce you to him here in a later video. But for now, that's another way to using dry needling techniques can also stimulate that fibroblast phase 1 healing effect.